Hello everyone, my name is Adrian Tapia and I'm going to talk about Lindsay's nails and chronic kidney disease. First of all, chronic kidney disease is a general term for the heterogeneous disorders affecting the structure and function of the kidney. Basically, it's a progressive loss in kidney function over a period of months and years. Symptoms of worsened kidney function are not specific and might include feeling generally unwell and experiencing reduced appetite. The causes. In developed countries, chronic kidney disease is generally associated with old age, diabetes, hypertension, obesity, and cardiovascular disease with diabetic glomerulosclerosis and hypertensive nephrosclerosis as the presumed pathological entities. However, the exact diagnosis is often difficult.
Kidneys are a pair of about 12 centimetre long bean-shaped organs. They lie at level of your waist on the back side of your body. Every human being has two kidneys which lie on the right and left side of the spine. The kidneys produce urine. The urine flows from the kidney through the ureter to the bladder. The bladder passes out the urine through the urethra. Kidneys have three important functions. They filter harmful waste products from the blood and drain them out via urine. They balance the level of fluids and salt in the body. They produce hormones. Chronic kidney disease occurs when there is a change in the structure or function of the kidney. An infection, damage, tumour or side effect of certain medications can cause kidney diseases. A kidney disease often has great implications on health and the functioning of the rest of the body. If you're suffering from a kidney disease, kidney failure can occur. In that case, your kidneys are not able to filter waste products and fluid adequately from your blood and extract them from the body. When the kidneys don't function properly, you might have the following symptoms: fatigue, nausea and loss of appetite, skin itching, high blood pressure, difficulty in concentrating, difficulty in sleeping or excessive sleep, shortness of breath. If the kidney functions can't be restored and both kidneys fail, then dialysis is needed. It is necessary if the function of the kidneys is less than 10%. The function of your kidneys will be performed artificially. There are two major types of dialysis: hemodialysis and peritoneal dialysis. In hemodialysis, your blood is filtered through a dialysis machine outside your body. In peritoneal dialysis, a dialytic fluid is flushed through your abdominal cavity, extracting the waste products from your blood. An alternative for dialysis is kidney transplantation. You get a healthy kidney from someone. Your general practitioner can give you more information about the disorder and its possible treatments.
The signs and symptoms are blood pressure is increased due to fluid overload and production of vasoactive hormones created by the kidney via the renin-angiotensin system. Urea accumulates, leading to azotemia and ultimately uremia. Potassium accumulates in the blood. Erythropoietin synthesis is decreased, causing anemia. Fluid volume overload symptoms may range from mild edema to life-threatening pulmonary edema. Hyperphosphatemia, also hypocalcemia, metabolic acidosis due to the accumulation of sulfates, phosphates, uric acid, etc.
My name is Leslie Spry, and I'm a kidney specialist in Lincoln, Nebraska. I'm here on behalf of the National Kidney Foundation to talk with you about understanding chronic kidney disease. And this will introduce you to kidney disease signs and symptoms. Kidneys are extremely important as far as the cleansing of blood, and perhaps the most important thing I can impart to you today is that kidney disease often has no symptoms, and that's what's the most difficult part of kidney disease. Kidney disease may present in its very advanced stages without any symptoms at all, and that is unfortunate. Unless you have blood testing, you may not know that you have kidney disease. However, some people do have symptoms of kidney disease. Those symptoms might include weakness, difficulty with urination. We sometimes see foamy urine, such that the urine is extremely foamy and looks like a head of beer. We also sometimes see darkening of the urine, such that it becomes Coca-Cola colored or somewhat dark. Puffiness that occurs around the face and eyes, puffiness that occurs around the ankles, and puffiness that may be generalized on occasion. Sometimes kidney disease can cause back pain, but the most common cause of back pain is still musculoskeletal, not kidney disease. Finally, in the advanced stages of kidney disease, weight loss, nausea, vomiting, and itching may occur, but again, this is in the very advanced stages of kidney disease, which is unfortunate. Next, we'll discuss the risk factors associated with chronic kidney disease and who is at risk.
The epidemiology of this unfortunate disease is that about 1 in 10 people have chronic kidney disease. African Americans, American Indians, Hispanics, and South Asians, particularly those from Pakistan, Sri Lanka, Bangladesh, and India, are at high risk of developing CKD. African Americans are at a greater risk due to prevalence of hypertension among them. This is another video about the pathophysiology.
Hello, in this video we're going to talk about chronic kidney failure. It can also be referred to as chronic kidney disease, but failure, I guess, is the end stage. And chronic kidney failure is essentially where you have loss, an irreversible loss of the nephrons. And the nephrons are the functional units of your kidneys. And this can result in a toxic state, such as uremia. And we'll learn about that in this video. So here, before we go into chronic kidney failure, let's just recap the anatomy slightly. So here I'm drawing the kidneys. The kidneys connects to the ureter, to the bladder. Bladder stores urine, ready for micturition. And here we have the inferior vena cava and the descending aorta, which has vessels coming in and out from the kidneys. Okay, so there are many causes of chronic kidney failure, and these include acute kidney injury or acute kidney failure, hypertension, diabetes, and other kidney diseases. Other kidney diseases includes polycystic kidney disease. So all of this can lead to an irreversible loss of nephron, which is chronic kidney failure or disease. So let us look at each of these causes of chronic kidney failure in a bit more detail. Let's begin by looking at acute kidney failure or acute renal failure. It's the same thing. So acute kidney failure can lead to chronic kidney failure. Acute kidney failure, unlike chronic kidney failure, is reversible. And there are many causes of acute renal failure in itself. One way to categorize it is into pre-renal causes, intrarenal causes, and post-renal causes. So pre-renal cause includes renal artery stenosis, heart failure, and hemorrhage, all which leads to acute kidney failure. And then you have intrarenal causes such as glomerulonephritis, tubular necrosis, and interstitial nephritis. All this can also lead to acute kidney failure. Then you have post-renal causes such as benign prostatic hyperplasia, renal stones, and tumors. It is also important to note that pre-renal causes and post-renal causes often lead to intrarenal causes, essentially, and this will all lead to acute kidney failure, acute renal failure.
Well, we're gonna stop the video here and continue with the exposition. Okay, Lindsay's nails, or also called half and half nails, were described in 1867 as red, pink, or brown bands occupying 20 to 60% of the nail bed in patients with chronic kidney disease.
Hello and welcome. This is Pranab Chatterjee bringing to you yet another medical podcast about a condition which has a rather quirky eponymous pop culture parallel. And since that is not something quite so common in our day-to-day medical dealings, I decided to go ahead and make a podcast about it. Now, when I say Lindsay's nails, the image that flashes across the inward eyes of most of us pop-savvy doctors is this: Lindsay Lohan with her famously rebellious nail art which said by a red, brown or pink discoloration of the distal nail bed occupying 20 to 60% of the nail length. Although this picture shows half and half nails in the fingers, the toenails are also susceptible to this condition. In contrast, take a look at a normal nail and what it's.
Okay, the epidemiology of this disease is about 70% of hemodialysis patients and 56% of renal transplant patients have at least one type of nail abnormality. Absence of lunula, splinter hemorrhage, and half nails were significantly more common in hemodialysis patients, while leukonychia was significantly more common in transplant patients. There is a differential diagnosis of this disease. The terry nails is defined as a 0.5 to 3 millimeters brown to pink distal band with proximal nail bed whiteness occupying approximately 80% of nail bed. This condition is frequently associated with cirrhosis, chronic congestive heart failure, and adult-onset diabetes mellitus. Physiopathology of the Lindsay's disease: the proximal white band is thought to be a result from a chronic anemia and the brown band from increased melanin deposition distally, possibly from an increased concentration of beta melanocyte stimulating hormone. There is no specific therapy beyond the treatment of the underlying chronic kidney disease. And that's all.